Mom's hemorrhoid horror story like you never heard before.
Bam, they were back way worse than the first time. The doctor told me there was no treatment.
Can the doctors cure her? Also, coming up next, a mom comes clean about her hemorrhoid horror story. Why you shouldn't suffer in pain either.
I started getting really concerned that maybe something else was going on.
When it comes to an embarrassing body issue, most of us hate talking about it, or we just wish it would go away. Well, what happens when it ends up dragging on year after year?
My name is Sarah. I'm 31 years old, and I live in Atlanta, Georgia. I've had hemorrhoids for about 5 years now, 5 straight years of hemorrhoids. And I found out about them when I was about 8 weeks pregnant with my second daughter. I went into the bathroom one day when the pressure was just, it was mounting, and I had to see what was going on. I had to check it out. Oh my God! What is this? Oh my, I have hemorrhoids. So I quickly got an appointment with my gynecologist. She told me that hemorrhoids for pregnant women are completely normal. After my daughter was born, I thought that the hemorrhoids went away. They were gone for 3 months. I thought it was totally home free. And then, bam, they were back, completely intense and way worse than the first time. The cream that the doctor gave me for the hemorrhoids, it was a prescription cream, and it didn't work. The hemorrhoids got really intense the past year to the point where I started getting really concerned that maybe something else was going on. I've had more pain than not. It's been more intense than ever, and since then I've just given up. The doctor told me there was no treatment, that it was either the cream or I'd have to deal with them for the rest of my life. Hemorrhoids affect my life because they make me feel less confident every single day. Also, who wants to get frisky when you have hemorrhoids? There's some nights where I have to put the hemorrhoid cream on and I'm screaming from the bathroom to my husband, "Don't come in here, I'm putting my hemorrhoid cream on," and he's like, "Gross," and that's totally the mood killer right there. It's been such a long time since I've been dealing with this hemorrhoid situation and the pain and the uncomfortable feelings. I just want it to go away once and for all.
Is Sarah's problem actually hemorrhoids or something else? And why hasn't a doctor been able to figure it out? We sent her to proctologist Dr. David Rosenfeld in hopes that he could help.
Hi, Mrs. Hosseini, Dr. Rosenfeld.
How are you?
Nice to meet you.
Nice to meet you.
So tell me of your tales of woe.
My tales of woe, yes.
Do you feel lump all the time and sometimes it's more swollen than others?
Yes.
Any sharp pain?
No sharp pain.
No sharp pain.
And then last year was when I started noticing the blood in the stool.
The blood you saw was on the stool?
On the stool.
Coated, okay. The thing about hemorrhoids, you can't lump it all into one category. If you have 1 or 2 external hemorrhoids, I remove them, I don't put stitches in. It's more of a 3 to 7 day recovery. But if it persists and it's outside and we need to remove it, we'll talk about it. We just have to take a look and see what's going on. That's what you're feeling?
Yep.
And it swells.
Yep.
So that's an external hemorrhoid.
It just feels like there's like a growth. I always say that when I'm like, it feels like there's something growing there.
Well, there is. It's your vein. It's expanding.
Okay, that is feeling scratchy.
Are you going to feel cold and pressure? Cold. Pressure. So fingers, slow, deep breaths, breathe.
Yeah.
Sarah's here along with Dr. Rosenfeld, and Sarah, I saw your face there, and the first thing I have to say, so that you get over the embarrassment from the beginning, there are a lot of people in this world who have been in your shoes.
Right.
And for you to just open up about it, you know.
Everyone!
How are your hemorrhoids?
It happens. It happens. Let's celebrate that it happens, folks. And by going to see a specialist like Dr. Rosenfeld, if something like this has been going on for years and years, for anyone out there watching, it's time to go see this guy. To get to the bottom of the matter.
Literally.
Right. In the end, everybody comes to see me.
Yes.
So what did you find on your exam?
I found on my exam that Sarah had 1 external hemorrhoid that she told me was the bothersome hemorrhoid. And I also found internal hemorrhoids, which is the source of her bleeding. And so I treated her internal hemorrhoids to shrink them. And if you put a special sclerosing or shrinking agent in, the hemorrhoid will shrink. And because of the large internal hemorrhoid pushing pressure on the outside hemorrhoid making it swell, this could help both indirectly. And now Sarah lives out of state, so people in state close to my office, I'll tell them, I treated your hemorrhoids, I put them on a fiber, tell them just do their best, have regular bowel movements. When their symptoms come back, they come to the office. If that hemorrhoid is bothersome in a year or so later, we can continue this treatment without any pain. I mean, when she was there, she looked uncomfortable, but I actually treated her hemorrhoids. She felt no pain. So Now, if the hemorrhoid comes back and persists and it's an external hemorrhoid, I would remove it in the office. And here's the hard thing. Everybody who goes on and has hemorrhoids looking in the internet about hemorrhoid surgery, they're looking at patients that had old-fashioned 3-quadrant, we'll call it hemorrhoid surgery, internal, external, outpatient, big stitches. The stories are horrific, and I know because I've done the surgery. I really don't like doing that surgery. But to remove 1 or 2 external hemorrhoids in the office, it's about a 3 to 7 day recovery, and because there's no stitches and the cuts are smaller. So patients read things and they get scared and they don't want to come in. When they do come in and I help them, they don't go on Facebook and say, oh my God, I went to the proctologist. He removed my hemorrhoids. It was the greatest experience I ever had.
Unfortunately, most hemorrhoids, Dr. Rosenfeld, correct me if I'm wrong, will resolve on their own with proper conservative treatment. But I think the biggest mistake people often make is with a really troublesome hemorrhoid, they'll go see, either they'll come to the ER or they'll go see their primary care doctor, and there are things that can be done, no doubt.
Right.
But when it gets to the point where this has been bothering you for years and years and years, there's a reason why. You've been doing this for a long time.
Yeah, 19 years.
This is all you do.
That's all I do. Proctology.
You know,
all I do.
know that space.
I'm a butt doctor.
That's
it. All I do.
That is it.
Well, I will say this. I'm happy that you're willing to talk about these subjects. That's why we do this show. Same idea. You just talk about it.
You gotta talk about them so you can get treated, you know?
Yeah.
That's right. 100%. And we love that, don't we, here on The Doctors? If it's embarrassing to you, it's embarrassing to others, but I'll tell you what, there are a lot of people dealing with it. Sarah, we're just glad that you're feeling better, Dr. Rosenfeld.
Me too.
Thank you so much. More to come.